Welcome to Healthcare IT Today. I'm John Lynn, together with my colleague and friend, Colin and The world of technology and healthcare are ever-changing in new and novel ways, and that's why we love this stuff. So join us as we discuss the latest healthcare and health IT news, meshed together in new ways, which help generate ideas and new perspectives. Plus, we'll have a little fun along the way. On today's episode, we're introducing a new segment called 5 Surprise Questions. So be sure to follow the show on Twitter at the hashtag HITSM and our personal accounts at TechGuy and at Colin_Hung. Plus, check out our 13 years of health IT blog content at healthcareittoday.com. You ready to be surprised, Colin?
I'm always ready to be surprised. Actually, I'm constantly surprised by you, so this should be kind of interesting. So just for the audience benefit, we have not given each other the questions. These are totally surprise, so we're going to totally wing this episode and see how it goes.
Right. So Colin created 5 questions for me, and I created 5 questions for him, and neither of us knows what we created for the other. So it should be an adventure.
Yes, we're going to try to avoid stupid answers if we can.
It'll be entertaining, hopefully, and I think informative. That'll be good.
There you go. There you go. All right, so let's get started with healthcare IT question number 1.
Am I going first?
Yeah, why don't you go first? You go first. John.
Okay. So my first question for you is, what technology or solution did you see and think, wow, this is going to really improve healthcare?
Wow. You mean over the last year or like anytime?
Anytime, I think. It could be the cell phone. It could be, I don't want to lead your answer, but yeah, anything that you've seen and you're just like, dang, I wish I would have thought that.
Well, this is probably gonna go way back many years, but when I first saw a automated transcription and dictation tool that was able to translate voice into text, specifically for medical practices like physicians. To me, I thought this was probably about 10 years ago I saw it. And it was terrible. Like, it was just, it was really inaccurate, but it got enough right that I thought this, when it's perfected and as we get better, is going to, radically change healthcare. Because at the time we were still sort of in the paper-based world, right? We're still doing everything manually. EHRs hadn't really come into being fully yet, and really was just being used predominantly for transcribing services. And I thought, wow, this is going to revolutionize everything. We could do analytics on the text and yank out all this valuable information. So little did I know we'd still be waiting for all this 10 years later, because I thought it was going to be it's going to be 2 years from now. We're going to be talking into our computers and in the healthcare field. So anyway, that to me was the one technology that really truly I was floored by, and I couldn't get enough of it. I was standing in that booth, I forget who it was that I was standing in, but just watching that technology work was amazing.
Yeah, Dr. Nick made me fall in love with that technology when he was working at M-Modal 3 companies ago. It was amazing to see the potential, and I think we're actually almost there. Now it's changed it from voice recognition to ambient voice technology is what they're calling it now. But we'll see if the rebranding actually achieves results. But I like it. It was actually making the doctor more efficient. Technology should do.
That was my thinking back then. But how did I would never. I just wish I came up with Alexa first, right? That would have been. Anyways, that was mine.
All right. So what's my question?
Okay. So my question for you is, John, will blockchain ever live up to the promise in healthcare?
So this is kind of a nuanced question, because if you would have said, will blockchain provide value to healthcare? That's a different question, though, than what you asked. Because will it provide some value to healthcare? Yes, I think it will. But will it live up to the promise is a very different question. And I think that's easily no. No way. Is it possible to live up to the hype? I don't know if has any other technology been more hyped than blockchain? The amount of dollars that have been invested on blockchain is just astounding to even consider. You put blockchain in your deck and you got money, it's felt like. So it's impossible for it to live up to that. But I do think it will provide very narrow slices of value in credentials credentialing and trust between partners and a few things like that. But no way it lives up to the hype.
It's funny. I mean, who knows, right? The jury's still out. We still might see some value, but I almost equate, blockchain today to where neural networks were like in the years past, where maybe one day it'll become the foundation for something else. Like neural networks became the foundation for what we now call AI, but no one implements a neural net, right? Like no one says, "Oh, I'm going to implement a neural net today," or "I have a neural net company," and yet, the same thing I see happening with blockchain. You add, like you said, you add blockchain to your deck today, and you're still getting attention. But I think the shine has come off because we haven't really seen a lot of practical, blockbuster type of applications based on blockchain yet. So, at least in healthcare. So, yeah, I wrote the question on purpose because you're right. I'm with you. I think it'll provide some value at some point, but whether it lives up, I don't think it's going to live up to this hype.
Yep. Cool. So the next one is the fun question. So here's the fun question for you. You've traveled all over. I mean, in your career, and even as now working with healthcare, so you go to conferences. You've traveled all over. You should have status on everyone permanently for lifetime. But and you're always eating out. So my question for you is, what's the best meal you've ever eaten?
Wow, what is the best meal I've ever eaten? Okay, well, on the road, there's one, and this is gonna sound so funny, but the best meal I ever ate was at Fogo de Chao.
Oh, wow, this is surprising. It's delicious, man.
At Fogo de Chao in Atlanta. So it was the first time I'd ever been to a restaurant like that. Never even heard of it. And I was with a small company then, and there were three of us that were just on this at this conference. And we were staying at a hotel that was sort of like next to it. And so we could smell it, right? And it's like, oh, we should go to this place. None of the three of us knew what a Brazilian steakhouse was. We just thought it was thought it was like Ruth's Chris or something, right?
Yeah, get a steak, get some potatoes.
Yeah, exactly. That's what we thought it was. And so we got there at like 8 o'clock. Because after we finished the client or the conference, it was late. We went there and they couldn't seat us. They said they couldn't seat us until 9:30. And so we said, okay, we'll come back. So we didn't even sit around to see what it was like. We went somewhere to get a drink, came back, and then we got there and we're like, what's going on? So it was our first exposure to that, where they come and slice off the beef. And I'm not kidding, John. We stayed there from like 9:30 and we closed the place at midnight. Like we were there for 3 hours and we never stopped. They just kept bringing stuff over. Like we must have left that place 10 pounds heavier. Like it was just crazy. That's probably the best meal I ever had because it's just so different and so delicious. We were hungry, and anyway, that is probably the most memorable meal I've ever had on the road.
Nice. See, I'm glad I didn't ask myself. I don't think I'd be able to choose. The answer is Italian, but I'm not sure which Italian meal.
Okay. Well, actually, so my question is very similar to the one you just asked me, but you've traveled around as well, both locally in the U.S. and internationally. And I know, of course, you love Italy and Italian food, but what is the one city, other than the one where you live, that you would actually live in? What's your second city that said you would go, I would live there?
Man. Live, do I have to bring my family, or is this a retirement? Oh, that's tough. Because that's the hard part. Like, I always dream of having a second home in Italy, and a place that I can just go with my wife and just love the Italian culture. But I don't want my kids raised there. So, oh man. But where would I live? I mean, it's interesting because we had this choice 5 years ago, and so we chose Vegas because we love it here. But the only other one that was in the running was actually Salt Lake. Because we weren't going to move to some random city just because and uproot our family. So I guess Salt Lake City would probably be the answer.
Right.
But if I'm retired, that choice would be very different. If my kids are out of the house, it would be very different. I don't know. Yeah, that's a really good question. Wow.
well, for the record, mine would be San Diego, but Toronto is my home and I love it here. But if I had a choice of wherever to live, I would probably pick San Diego.
I didn't say you'd hate the state tax, but I guess you're a Canadian, so you're used to the high taxes.
I'm used to it. I'm just not used to the forest fires or the, but and those kinds of things. But it's a beautiful temperature there all the time.
Yeah. So that brings us perfectly to our third question. And really our second health IT question, and that is, what's one thing the U.S. can learn from Canadian health IT? And of course,
Ooh.
I should give the background that you live in Toronto, which you pointed out. So, what can we learn the U.S. from Canadian health IT?
Wow. Okay.
I need an
Well,
import.
yeah. So besides how not to implement things, sometimes, we here Canadians, we're the land of pilots, never-ending pilots, because we don't really want to implement anything. We just pilot forever, and we wait for other people to prove it for us. But putting that joke aside, I think the one thing that we can learn, or that we should export, is Canadian IT and Canadian healthcare operates in a perpetual state of too much demand and having to rationalize and prioritize who gets care and why they're getting it. And this is, I know, a foreign concept to the US, but it forces thinking around, okay, who can we put on a waiting list? And it's okay for them to wait. And they have to build these into the systems to automate it, right? To say, okay, I've got a list of 20 possible patients I can see. Which are the 5 that are critical and I can see them right away, which happens, and then who are the 15 that can wait, and then what's the prioritization of that wait? So because of the way the Canadian system is built, we have to build in this kind of triaging, if you will, and I think that's something we can actually export, because we're going to need it. I mean, eventually the resources are going to become, either because of cost or because of other reasons, where it's just, you can't give the same care to everybody. So how do you rationalize it? And how do you also cut down the cost of that as well? Because there are some people who just go, you know what, you start looking at that list and go, there's 15 people who aren't a high priority. Is there an alternative? Right? Then you start really looking at it going, well, maybe number 15 there, like, do they really have to do this surgery? Can I do rehab instead, which is a cheaper option? So I think it's really more, I wish I could say it was a technology, but it's really more a way of thinking that I think Canadians could export to the US.
Well, technology enables it, and it is interesting. I mean, that's the argument many people use for Medicare for All and why we don't want it in the U.S. So it's interesting you use it as an advantage, and it definitely, I think the only way to do it at scale is with technology and the data.
It does come with a price. I mean, don't be wrong, we pay high taxes, of course, but it also comes with the price of, yes, we can't get care exactly when we need it, non-elective. Like, well, sorry, when it's not critical, right? When it's critical care, you get it, but when it's not critical, yeah. Okay, so my question for you, John, now that we have this mountain of data in healthcare, which is the piece of data that you keep saying we should use, or you believe we should be using, but no one is?
Piece of data that we should use that no one is. I keep going back and forth on this in my head, because on one hand, I ascribe to the idea of skinny data, which is, hey, let's stop building these enterprise data warehouses that have all of the data and do nothing. Let's do some slices of data that are valuable and actually improve care. I guess for me, it's probably genomic data.
Okay.
I think that's where we see the most promise, is the genomic data. And we have these databases that are being built around genomic markers that can help identify the treatment or the care plan that could actually improve it. I love the story, and I forget the exact example, but it was a really rare cancer patient that was able to be treated with a blood pressure drug or something like that. And you're like, why aren't we discovering this sooner? I think we all there's probably drugs that can help a lot of us with really challenging health situations, and it's not being done. So I guess I'll take genomic data, which is a really big piece of data.
I love it. You chose a large chunk, so you hedged your bet. I like that one. That one.
That's true.
Hey, if you're just tuning in, you're listening to Healthcare IT Today with John Lin and Colin Hung. Please take a minute to check out our story archives at healthcareitttoday.com, and please rate us and review us wherever you're listening to this episode. Tell us what you enjoyed, tell us what you didn't, which host seems nicer, anything really, just let us know what's going on. You can do that either in the comment section where you're listening to this, or on Twitter using our accounts at TechGuy and at Colin_Hung. We look forward to receiving your feedback. So John, that's kind of a nice break, but let's go to a question that I'm looking forward to asking you around your career. So this is kind of a career question, kind of not, but see, one of the things that I knew about you way before I actually met you was, you were the guy with the salmon pants, right? So it's become actually a career definition. Like you've embraced it. You own the salmon pants. But I am very interested, and I'm sure our listeners are very interested. What is the story behind those salmon pants?
The story behind the salmon pants. Well, it was funny that hymns. I think it was Stephanie, our friend Stephanie, tweeted salmon pants is trending on Twitter the first time I wore them. So I guess that's funny that you'd bring this up. Well, the story is actually quite simple. I was hanging out with my aunt, who is this wonderful lady. She worked for Nordstrom for 30, 40 years or something, all the way up to regional customer service rep and everything. We were hanging out one holiday or something. I was visiting, and we were talking, and she's like, John, I think you need a signature look. I'm like, a signature look? What do you mean? And I'd started doing some talks and different things around town, and she's like, yeah, you need a look that is special and that people will remember. And I'm like, okay, well, it's interesting. So I thought about it, and I sat on it for a month or two. And then I was going up to visit again the family, and she was there, and I said, okay, I'm going to make this a business expense. I'm going to give you a budget because, of course, I don't give a rip about clothes. I don't care what I wear. Like, that's just who I am. But I was like, it makes sense, right? Like, if I look a certain way or professional, then, you could do better in your career. So I'm considering it a business investment, right? I'm going to give you this budget of money. We're going to go to the store, and we went to Nordstrom. Shout out to Nordstrom, which, interestingly enough, I worked there as a kid. But we went to Nordstrom, and we went around, and she was my personal shopper, and she brought in some other people that she knew. And then she showed me these salmon pants. And I'm like, I'm not sure. Do I want to wear those? She's like, John, do you wear these? They're going to stand out. And sure enough, she was right. So there you go. I dropped the money, and the salmon pants were born.
It has become a career signature piece of clothing. So because you can't talk salmon pants without identifying you as an individual. So it worked. It definitely worked thanks to your aunt for that one.
It's interesting, right? I mean, the question is, do I always wear them? Maybe I should go full Steve Jobs and just wear salmon pants. It might be easier. The other irony of this whole situation is when I did the first purchase, I went back to her about 6 months, a year later. I was like, oh, dang, I only have 4 outfits now. I got to go buy some more outfits because if I wear just these 4, like everyone will be like, oh, do you not have any other clothes? I was like, oh, okay, dang, I guess this is just not a one-time investment. Fashion is an ongoing investment. But anyways, it's been good, I think.
But for you, salmon is always in season.
That's true, and that's actually the thing people tie me to is this Nantucket where, but it's been all right. All right, so here's one for you.
All right.
Who's been the most influential person in your career, and what did they do to really, have that impact on you?
Wow. Okay, that's an interesting one. So who has had the most impact on my career? Yeah. So I think it would have to be my very first manager that I worked for at this imaging consulting company. And when I say imaging, I don't mean like radiology imaging. I mean like document imaging. That's where I first started.
Oh, it wasn't your salmon pants image?
No. So it was a guy named Gar Moret, and he was an engineer like I am, and he was a civil engineer. I was a mechanical engineer. This was my first job right out of real job right out of university that wasn't in an engineering firm. And an engineering firm, you typically work 9 to 5. It was unionized, so like 5 o'clock came around, like basically it was a ghost town, right? Like it was just, and so I had never really been exposed to that sort of entrepreneurial world. And so when I joined this company, Gar was my manager, and like for the first few months, I would just like 5 o'clock came along, I was like out the door, right? And And that was the way, because that was just the way I'd been brought up. All my work terms had been like that. And so he sat me down one day and just had a chat about like what I wanted to do, where I was going, and basically he just basically set me straight and said, hey, listen, you want to be a 9-to-5 person, doing this isn't for you. Being in tech isn't for you. And this is how people behave. And he was really nice about it. He was just telling me it. And then he also taught me a lot about his career and how he went from, all these different areas. He was a developer, and then he was, a salesperson. And so he was, through the years I was there, he was just a great mentor, and just was able to, tell me or teach me a lot of things just from his own career, which some of the lessons I still take today. So I'd have to say him in terms of my career growth. Different answer if you'd asked me around healthcare, but just in that one is definitely, I remember a lot of what he taught me the most.
That's awesome. It's funny, my answer would have been my first boss too, so I'll save that story for another day, but that's really awesome. I love that he shaped it. That's great.
Yeah, it was just nice, and it was nice to have that common, like we had the same background. He was an engineer, ended up in tech, and it was just so helpful. So, all right, let's get to the last health IT question, John.
Sounds great.
This one's kind of a fun one too for you, but so over the years we've had some colorful characters in healthcare, and some colorful companies. So we've had, of course, Jonathan Bush, former CEO and founder of Athena Health. We've had, the whole Theranos situation. And then, of course, last year we had recently the Google Ascension story break, and all the fuss that was made about that. So what or who would you like to see going forward to be sort of that lightning rod, that interesting person, interesting story? Like, if you were to build somebody, who would it be? Like, what would you mix and match? What kind of a story would you want to be in 2020 to be that sort of definitive healthcare story?
Well, I mean, I guess I could take it a lot of ways. Interestingly, I always define Jonathan Bush as the best interview in health IT, because you literally have no clue what's going to come out of his mouth, and that makes for an exciting interview. But I'm not sure that's what I want for my healthcare, or my company. I guess I would probably. So do you want an individual person, or do you want the attributes?
Give me the attributes. Make the attributes. Like, what would?
So the attributes I want from a CEO, man, I guess, Jonathan Bush is the epitome of some of those attributes, because what he had that was so appreciated by many of us was he was brave, and he wasn't afraid to go against convention. And even though he often was bombastic and even edged on the line of some of the many Me Too subjects, and he could be abusive from what I heard. I never saw it myself. From a boss perspective, what I loved about him and the character and attribute I would want from that leader is someone that's brave enough to say the things that we're all thinking, but we're afraid to say, or that we didn't know how to articulate, which was one of my favorite characteristics of Jonathan Bush, is he could articulate what all of us realized but didn't know how to say. And so that's, I think, a powerful attribute of a leader, is being able to take a complex system like healthcare and dumb it down into something really simple. Interesting enough, my brother is very much like this. He can take any situation, a challenging situation in the family or a challenging situation politically, and he can dumb it down to the 2 or 3 things that really matter. He said, well, it seems really simple to me. These are the 3 things that matter. Just evaluate those, and then you'll know the answer. And so, someone that can do that is just extraordinary. And to me, that's what we need in healthcare, because if you want to complicate something in healthcare, you can. And so you need a real leader that's visionary, that can say, no, throw out all the complication. These are the 3 things that matter. Let's do them, or let's make decisions based on those 3 things, and we'll have something effective. So yeah, shout out to my brother.
Nicely done. Nicely done.
Cool. So the last one for you is, and this will be interesting. I don't know if you're Canadian enough to do this one, but What's the most annoying thing you hear over and over again about health IT, and you're just sick of hearing it?
Oh, wow.
Are you brave enough to share?
Yeah. Um, okay, so I'll give you two answers. So from people who aren't in healthcare, there is one thing I hear about healthcare from people who aren't in the business that I hear over and over again, and it's just clearly, it's annoying because clearly you don't know anything about healthcare. And that is, I hear all the time, well, just cut everyone's salary. Like, that's the way to cut the cost out of healthcare. You're paying everyone too much. Like, that's like, because all they see is that list of doctors and how much they make, and they hear the CEO of the hospitals are making this much, so they think it's a people problem, right? They just think that, oh, if you just cut people's salaries, all of healthcare's costs will be solved. I hear this actually from a lot of my friends who aren't in healthcare to go, actually, that's part of the reason why healthcare costs so much. So that's sort of on the
Interesting.
non-healthcare
What about the
side.
health IT side?
So
Or
the
the
healthcare
healthcare?
IT side, the one thing I am starting to get a little bit tired of hearing is the whole non-usability of EHRs. Like, I
Hmm.
think we've heard it enough now. We get it. They aren't very easy to use. Yes, you need 1,000 clicks, and yes, it's a problem. I'm not saying it's not a problem. It's just like we've been saying it now for 7 years, right?
But if we say it 12 more times, are EHR vendors going to finally hear it? Is that, yeah, I mean, that's a good point.
Right? Like, I just you either, like, I think we're at the point where, okay, great, like, what's the alternative, right? Either get part of it behind the solution or just get off that EHR. Like, it's been 7 years, you can get off it now, right? You can migrate to something else. But I just, I think at the beginning, it was people needed to hear it, but now I think, okay, look, you got
Yep.
entire industries, even the media, everyone in the mainstream media is quoting it. We've got the government even trying to regulate it, like, so I think it's time that gets put to rest, and that to me
That's
is
great.
one.
They've heard it and they've internalized it, or they haven't and they're not going to, right? I think that's what you're saying.
Yeah, yeah. Time to move on. Time to move on. Anyways, John, this has been
Awesome.
a very interesting episode, and I'm gonna have to say we're gonna have to do this again because I think it'd be kind of fun. Um,
I think it's fun. You'll have to let us know on Twitter or whatnot if they liked it.
yes, there you go. And one day we'll have to get a third person here so that they can ask us random questions that they pulled off of Twitter that we don't know and can ask us. That would be
Nice. I
interesting
like it.
to do. Crowdsource that. But thank you to all of you who tuned into this episode of Healthcare IT Today. Find out more details about our show by clicking on the programs page on healthcarenowradio.com. And please share your voice and engage with the community at healthcareittoday.com and on Twitter using the hashtag HITSM. I'm Colin Hung with my friend and health IT collaborator John Lynn. Thanks for listening. Have a great week.